fellowship through YouTube.
Thank you. Please go ahead, and I want to compliment that you selected Professor Rohit and Professor Suman. I know they are amongst the best. Many people from overseas have written to me, my friends, once they heard and saw your brochure, that they have selected the best people. So my compliments, and I'll try and stay till 11:30 or so and be with you.
Okay.
Thank you.
Yeah. Thank you. Thank you very much, Colonel Rai. Please go ahead.
Sure, sir. So, moving ahead and setting the tone for the talks, we have with us Professor Suman Chakravarti, and his topic, of course, is community transformation via democratized diagnostic techniques for the underserved. Before we invite him for his talk, a brief about Professor Chakravarti. I hope you are able to see my screen, and you can see that his areas of work include microfluidics, nanofluidics, micro-nanoscale transport, with particular focus on biomedical applications, including novel diagnostic technologies for affordable healthcare. Now, he's an eminent scientist and a technologist, member of all the academies in country and abroad, awarded numerously, as you can see. But for the want of time, I take this liberty and without wasting any further time to invite him for a very anticipated and interesting talk. May I invite you, Professor Chakravarti, for your talk, please?
Very much.
I hope you will be able to share your screen.
Yeah, I will do that. But before that, I must express my sincere thanks to Professor Indranil Manna for giving this platform, very prestigious platform of the National Engineers Day. I am deeply humbled to actually speak in front of a legend, Dr. Sarin, the legendary figure in Indian liver disease community. We all respect him tremendously. And sir, if I make any mistake in any medical terminology, please forgive. I am also, deeply honored to share the platform with my young colleague Rohit, who is an outstanding scientist, and I believe that we will be able to come up with some recommendation at the end. And we have seen Dr. Sarin giving excellent recommendations of how we engineers can take forward, the medical research and technology development work. Yeah, so sorry for that, but I think that we can manage in this. So by taking the lead from Dr. Sarin's talk, as engineers, what we can do in the healthcare arena is something which needs much more focus than what it is currently drawing. There is a general belief that engineers can develop technologies and the technologies will directly get into the use by the medical community. Having said that, it is not as straightforward because human health is a very complex phenomenon, and working with human health is not like developing a machine or designing a machine and making the machine effective in a condition which is designed for certain purposes, because there is a huge variability and there are certain issues which make it very challenging. Now, one of the major issues where I want to focus on is the diagnostic technology, which is primarily the area in which most of us who are engineers and who work in the healthcare domain would invariably have some overlap. But at the same time, through my experience in working with diagnostic technologies, what I have realized is that it is not just the technology, but what I would summarily say as technology plus, something more beyond the technology, which would make sure that whatever interventions that we are planning for is actually effective for the benefit of the common people. Now, a lot of these technologies, which I am going to summarize, these are for primary healthcare. And when we say primary healthcare, the emphasis is not really to go for something which is a very so-called high-end aspect of the technology per se, but a technology which is simple, effective, and it can be disseminated to the last mile. Now, it is easier said than done, because the challenge is that when we go to the grassroots level and try to implement technologies, there are certain inevitable issues. Fortunately, with a lot of effort and initiative from the government and also the private sector and not-for-profit foundations, the digital health model is now very well spread across the country. And we all know that the modern era is an era of the digital technology and data sciences and communication in particular. Everywhere the internet connectivity is much better and improved as compared to what it was maybe 10 years back. So the digital health clinics, which maybe 10 years back were finding their challenges to operate, now with all the learnings that we have got from the COVID era, the online, or what I would say as the digital mode of communication, is so good that many of these digital clinics are functional quite effectively. I have given an example here where, with the help of our on-field partner, which is a not-for-profit foundation, Foundation for Innovations in Health, led by Dr. Shatadal Saha, we have developed an outreach at different places, even up to the remote Sundarbans, where we have the hub and spoke model in terms of maybe a central location, followed by decentralized approach through frontline health workers, who are typically the rural girls, who are trained and empowered with certain technologies so that they interface with the patients. The patients share their issues with them, and they enter that in a digital platform, be it a tab, be it a mobile smartphone, and then that same is communicated to a remote doctor who is sitting somewhere else, but the remote doctor can quite readily communicate with the patient. Only barrier maybe the language, but typically if the doctor can speak and communicate in the language of the patient, then this is never a problem. Now, where the main challenge of this system comes is that the doctor will recommend, of course, some basic medication and invariably some diagnostic tests. And these diagnostic tests are neither easy to do at the site of the patient. If they are done, it may be low cost, but it may compromise with the medical standards so that the result may not be acceptable, or the patient or the sample has to be transported to a remote center where there are other inevitable compromises like the patient's inconvenience, loss of daily wage, the delay in the results of the diagnostic solutions. So keeping all these into purview, the technology development in diagnostics that we all work on, they are not simply designed to be high-end technologies. They should be directed for certain innovations which will satisfy these boundary conditions. I have summarized those in a tabular form because as engineering designers, we always have to understand the constraints. We are talking about technologies which are no more going to be used in a high quality lab where you have highly controlled environment, including continuous power supply, high quality storage and transportation system, highly established supply chain of delicate materials, highly trained human resources, and usually when we are referring to the technologies in the high-end labs, we are not so much bothered about the cost factors, because there the technology and its robustness becomes the major focus. And that is how the scientific innovations in any sphere have been going on over the years. The glamour of science has always been reported as outcome which is cutting edge and which can disrupt the scientific community. Now, here we are talking about solutions which are definitely to be cutting edge, which would disrupt the community at large, but at the same time, it is not having the privilege of the lab conditions, which normally would be there for any technology to function. So I would give a few examples with our journey that we went through over the last several years. So we started with our focus on body fluid based test with the finger prick blood as an example, where using paper microfluidics, we have 1 drop of blood and we have a paper strip where the blood is just sucked in, and there is a micro channel on the paper which will make sure that the blood will move in a certain direction by capillary action to a site where there are reagents, and there is actually a very small filter in the paper strip which will separate the plasma from the whole blood, so that we can have only the plasma entering into the reaction spot, and then the reaction colorimetric change is recorded in a smartphone. The strip is inserted into the small box which is like a credit card reader where the credit card is inserted, and then you can have a mobile app which is taking over the image grabbing, image analysis, and from that we can get a result of the diagnostic test. So this is a summary of many of the tests that we have developed in this way, but at the same time, there are interests on different variants of similar technology, with the central mission that these technologies should be able to work in a resource constrained environment. Dr. Sarin was talking rightly about the fatty liver disease as one of the major challenges, and these are all non-communicable disease burdens complexly connected with various other diseases, including the cardiovascular ailments. Now, in the point of care arena, we do not have much of a simple low-end lipid profile test, which will talk about the different variants of cholesterol, LDL, HDL, and triglyceride. So we try to adapt the technology of the lab on a CD, which is a mini centrifuge. You can see at the bottom the video running. So you have a small motor which is spinning a disc. Inside the disc there are micro channels which are made by simple mechanical manufacturing and where a lot of engineering comes in. When it is rotated, the blood will simply move by centrifugal action, and the plasma which is separated is collected at different chambers in the same CD, and there are reagents for LDL, HDL, and triglyceride. It will react with those reagents. One of the major engineering design factors is how you program the rotation of this disc to make sure that you have optimal reaction conditions. And after the reaction, the color of the spots will change, simple colorimetric principle. But what we have done is we have not used any smartphone based analysis for this, but because there are multiple spots here, what we have done is we have adapted a office scanner and made a central hole in the office scanner which is of the same size of the CD, and scanned this entire thing using a scanning software, and used image processing with a bit of AI to make it more precise and quantitative, to get the screening test results for LDL, HDL, and triglyceride, all coming up within 10 minutes of the sample dispensing. We have also worked significantly in the infectious disease detection space, and the technology which we tried to develop during the COVID era, when there was significant crisis in getting the RT-PCR test done, because of the challenges in accessing the RT-PCR centers, where huge numbers of samples were to be tested on a daily basis, typically during the peak waves of the COVID. So we developed a portable, simple machine where instead of the PCR, the thermal cycle-based test, we made it isothermal, piecewise isothermal nucleic acid testing machine, which is called a SPINAT machine. And we applied it for COVID diagnostics. The particular application was known as COVID app, which was introduced from IIT Kharagpur at that time. And once we got it US patented, we tried to move on. And based on the current Indian scenario, we tried to adapt it for the TB diagnostics with the kind support of ICMR. And we have also tried several innovations to make this somewhat simple. That is a bit of adaptation of the sample collection itself, so that instead of the swab, we can have a saline gargle based test. So this is something on which we have been working on for some time. And I believe that with all these simplifications, the challenge which we have all faced is the compromise in the accuracy of the test. So how can we make engineering innovations to overcome these challenges? So if we look into all these innovations, the major challenges that we tend to face, and I think this is a challenge which is a combined engineering and medical aspect, is the optimization between engineering elegance and simplicity and medical grade acceptability. So if we make it too simple, too frugal, it may not be acceptable from the clinical standards. This is another example where we have tried to adapt the paper-based technology for evaluating antibiotic resistance in urinary tract infection. So it is simply the cultured E. coli which is being brought in contact with the antibiotic medicine, and then if the antibiotic medicine is able to kill the bacteria, then we have another layer. It's a multi-layer folded paper kit. There is a blue colored chemical known as chromogen. So if the bacteria is being killed, within a couple of hours, this blue colored chemical will tend to get into pink color. So the fractional change from blue to pink will be an indicator of the efficacy of the antibiotic. And it is very important as a life-saving measure for the doctor to have an a priori understanding in a personalized manner about the potential efficacy of an antibiotic medicine before it is administered. Getting into the imaging arena, we have also been working closely on the cancer screening program, and this is one of the major programs in which we have been, the screening of oral pre-cancer and cancer, which is one of the major public health challenges, typically at different locations where the tobacco as a consumption is a challenge. And of course there are other reasons for oral cancer which may start with HPV or other forms of infection. So if we combine all these challenges, then this is an opportunity where instead of going for a simple optical based screening, we have a system which is a torch like device which will take the thermal image of the lesion inside the mouth, completely non-invasive, and convert that to a blood perfusion image. And from a classification algorithm used with the help of machine learning, we can classify or categorize in this way pre-cancer and cancer patients and segregate them from other types of patients. We did first level of clinical work with the Guru Nanak Institute of Dental Sciences and Research, and now further developments on this technology is going on to make it more inclusive. We have also tried to endeavor on using the rich physics of fluid flow to adapt them into reagent-free diagnostics. So this is one classical example where we have a moist filter paper, a filter paper where we have glycerol soaked in it, and when we drop one drop of blood, the pattern in which the blood spreads, which is known as viscous fingering, as a low viscosity fluid, it displaces a high viscosity fluid, in this case it is glycerol, it tries to develop a pattern, and from analyzing the pattern, it is possible to tell what is the volume fraction of the red blood cells in the sample, and in that way one can use it as a readily approachable or readily accessible tool without any reagent for quite an accurate screening of anemia patients. But having said all these, one of the major challenges that we felt that many of these technologies have is that they need devices. Now, as engineers, we want to, or we love to work with devices, but we have to imagine that devices are not quite convenient if you want to make the test highly portable. If there is a diabetes patient who has to travel quite extensively, it is not so convenient that the patient carries a glucometer alongside with him or her and makes the test maybe whenever the person is there in a community center, maybe in a meeting, in airport, railway station, etc. So we try to migrate from device-based to device-free technologies, and then I started mentoring a startup known as Smart QR Diagnostics with the kind support of the DSIR, Government of India, through their CRTDH program, and then they blossomed from there and quite quickly adopted our technology, licensed that, and converted into a form of technology which we applied to different forms of diagnostic kits which just require a paper strip and a smartphone, no other device. So this is an example which is known as PrePap QR, where there is a paper strip and a mobile app. So this is a vaginal pH test that woman at complete privacy can perform. So it's a self collection of the vaginal swab, then putting it on the paper strip, and it is completely coded, and you take the picture of the paper strip, and you can see how the entire test works. So there is a strip, and once a picture is taken, the strip will be digitally analyzed, and the result of the vaginal pH and other forms of data will come out of that. We have always tried to use these technologies for resource poor settings. So in Sundarbans, we have tried to adapt these technologies under certain conditions where you will see that marginalized women who are not quite open to discuss their reproductive health issues to others, they try to get familiarized with this technology with the help of frontline health workers, and now they are using these technologies, and the results which are obtained from there, readily these results are made available through the mobile app to specialized doctors. So in that way, what we have tried to do is to not just develop technologies, but try to make an ecosystem around the technology. So the technology is developed in the lab. It is designed in a way so that not just in the lab, it will work in extreme harsh conditions where you do not have any reagent supply, because all these kits or all these strips have lyophilized reagents. They do not require any liquid reagent per se to be dispensed. You do not require a device except for a smartphone, which is available at most of the places. And there is a simple demonstration video or app which will guide the person to do either the self-test, or the frontline health worker, who is a minimally trained girl, will be empowered to educate the local women and youth and even the school children to adapt these technologies and take their benefit. So the whole emphasis has not been just to develop a technology, which is definitely important, but how to connect it with a holistic rural transformation. That means train and empower the frontline health workers, maybe encourage them to form enterprises, and encourage the startups to become entrepreneurs working on these kinds of technologies which are not so common, and then convert it into an ecosystem model where the local schools and community centers, they take part in a holistic transformation where we have certain pointers which we are trying to address. A Make in India scalable and sustainable solution for a global challenge, which will give more access to primary care at resource limited settings. Deployment oriented R&D ecosystem for the last mile primary care, including public health research and intervention to improve societal health indices. Facilitate large scale population cohort studies for understanding disease evolution, epidemiology, etc. through genetic, metabolomic and drug development research, which is one of the major points that Dr. Sarin was aptly emphasizing on. The last 2 points are bit more bit deviated from the so-called technology, that is livelihood generation, women empowerment and rural entrepreneurship. And it is all possible through such simple but highly needed technologies, and these are certain interventions which will generate new employment and job opportunities, and it also creates a new identity for any institution or the government as the friends of the community. So to summarize, what I can say is that it is not just one technology as a solution, but an intervention in an ecosystem approach. This is an example. This is a village known as Barra, which is located in district Birbhum in West Bengal, where in the pre-COVID era we started our journey by making diagnostic test camps, where some of our technologies which were at that point field validated, many of those are commercialized by now, but which were field validated at that point of time. So we tried to emphasize on developing the skill of the local community, including women, and I tried to mix our students and other staff who are working selflessly for these kinds of projects to develop a teamwork which will not just work on technologies in the lab, but which will disseminate at the last mile. So I would like to thank many of our collaborators, mentors, colleagues. There is a long list of very highly expert human resources and professors, medical doctors, industry partners, but more importantly, all these work because we have financial support. So I would like to thank in particular 2 important financial supports. One is the CRTDH, Common Research and Technology Development Hub on Affordable Healthcare, which has been generously sponsored by DSIR, and the ICMR Center of Excellence in healthcare, which has been supported by the ICMR DHR, and also various forms of support from the DST, the Ministry of Electronics and Information Technology, the Department of Biotechnology, IIT Kharagpur and IIT Kharagpur's alumni chapter, and various other private organizations, and of course our industry partner Smart QR Technologies for bringing a couple of these technologies from the lab to the market, which is now currently available in a commercial form. And I'm really very humbled to see that they have already received millions of orders, kits, which I dream that with the help of all the stakeholders, at some point of time, we'll be in a position to create a very disruptive impact to the society at large. Thank you very much for your kind attention.
Thank you, Professor Chakravarti. Now I'll request Professor Manna to kindly make his comments, sir.
No, I mean, more than me, I thought if anyone would like to interact with Suman, we all know his work. This is, first of all, I would say, setting up an example from lab going all the way to development of interventions which goes to the marketplace. And I mean, similar exploits we'll hear from Rohit, but Suman has been working on an area which is, I mean, truly a good interface between engineering sciences at very small length scale and bringing in certain uniqueness, which is very rare to see in that too in hardcore mechanical engineering domain. So a very extraordinary exploit, Suman. But let me hear if anybody would like to raise any specific question. I would like both